Good afternoon and welcome to the weekly Department of Behavioral Health update. Thank you for joining me on Friday afternoon. It's a little different on our schedule, but I appreciate your flexibility as we have many competing meetings these days. All right, we'll jump right in. In terms of the world, we now are over 210 million cases of COVID, over 4.4 million deaths. And the world is seeing a similar type of surge as we're seeing. You can see on the right-hand side that graph shows two peaks and the beginning of a third peak. And so this is happening worldwide. I often hear people commenting about what we've done right, what we've done wrong. People are fighting constantly about vaccination, masking, etc. The virus rages on. It doesn't really care about all of that. It doesn't. It disregards all of that, frankly, and it continues. Whether it's in the United States, where we have a very polarized society, or it's in developed part of the world or undeveloped parts of the world. And so that's what we're contending with right now. In the United States, similarly, you can see that massive surge we had in the winter, and now what's beginning to be another big surge. We have over 37 million cases, over 37.3 million cases in the United States, 625,416 deaths thus far. We do anticipate that number increasing with this current surge. Just a gentle reminder that we typically see cases go up, then hospitalizations, and then deaths. In California, we now have over 4 million cases, 4,084,799 cases, 64,503 deaths. We have overall 6.1% positive. That's down from last week, but already starting to trend up again. It looks like we might be stabilizing, but really hard to say right now because there's little bobbles in there, if you will. In Fresno County, we now have just under 111,000 cases. We are seeing a significant increase day over day, week over week now. We have 1,759 deaths. And in terms of hospitalization, we've now soared to 338 individuals hospitalized with confirmed COVID, 68 in the ICU. 17 beds are shown available. I just got off a call with public health and the media where we were very cautioned to recognize that just because it shows 17 beds, some of those beds are not staffed, and hospital staffing is a huge issue right now. I'll talk about it a little more in a minute. So if you look on the right-hand side, remember we were hovering in the 40s, occasionally the 50s, and now just a rapid surge up. We're now, if you look at the graph in the middle, you can see that peak one surge ago is certainly higher than where we're at now. We do not want to get to that peak. We do not have the staffing. We do not have the resources. We're also at a time of the year where people are going to the hospital for other reasons. The summer's a time that, and certainly after people have been cooped up with COVID, where they're getting injured. You have a lot more kids having accidents in the summertime. We have smoke in the air. If people have asthma, that can trigger an asthma attack. And people still have strokes and heart attacks. So when our hospitals are inundated this way, even if COVID itself doesn't overwhelm them, you might not get the care you need for other purposes. So if you're vaccinated, or if you've had COVID before, or you're unvaccinated and think it doesn't apply to you, or the hospitalization numbers shouldn't matter to you, then you better hope that you don't get in an accident. You better hope that you don't have an illness in your family that requires hospitalization, because we're in a world of hurt right now. In terms of testing trends, I wanted to show you we are certainly going up in the number of people tested, and yet again we have increased our positivity rate. We were 9.1 or so last week, and now we're at 11.2%. Our vaccination is going up. We're just under 1 million. I predict by next week I'll be reporting a number well over 1 million. We're at 996,797 doses, representing 432,467 who are fully vaccinated, either with a 2-dose regimen or a 1-dose regimen, and 87,233 that are awaiting their second dose. We are definitely seeing probably over 20,000 doses have been delivered in the last 10 days, so that number is going up. It had went down previously, as I've talked about. Almost half of our population from 0 to whatever has had at least 1 dose, so that's good. We're really, we really need to get over that 50% of the whole population as one of the next thresholds. And 60.6% of individuals 12 and older, for whom that's the only population that's eligible for a vaccine right now, have received 1 dose. We're definitely seeing more kids being hospitalized across the nation. That's not to say that we'll ultimately see a higher hospitalization rate, but it appears that the Delta variant is making more people get COVID. And the more people that get COVID, even if the rate of kids getting hospitalized isn't different than it was previously, there are more people getting it, so more kids are getting hospitalized. And there are parts of the country now who have no ICU beds. I think it was Alabama, I read, has what's called negative 22 ICU beds. So that means they have at least 22 people across the state who are receiving care outside of an ICU who need ICU beds. And so here you can just see that information. We're going up and up of both individuals over 12 and over 65. In terms of summarizing what's happening in our county, cases continue on an upward trend, hospitalizations continue to grow, staffing is at a critical shortage. When we had our last surge, we had a lot of supports, both in terms of the government being able to send what they called strike teams from the Department of Defense and such. Those teams right now are deployed elsewhere. The other ways that we typically get staff in hospital environments is through contract agencies, finding the resources we did previously. And so, healthcare environment right now is an area of high burnout. This is going to impact us likely for years to come. An exodus of staff from those systems who are just tired and fed up. And, we're going to have to contend with this as we move forward. We are seeing deaths increase again. Again, a reminder that those typically trail the cases and hospitalization. We are seeing that positivity rate increase. We'll be watching closely, hoping that goes down. And so most Central Valley counties, including Fresno, are in what we previously would have called the purple tier. I'll show you that graph in just a second. So just to show you the trend, we're on an upward trend as we stated. The blue is California and the orange is Fresno. You might see a slight leveling off of California. We're watching that very closely. There's some interesting trends going on worldwide right now where parts of the world that experienced a surge that had higher vaccinations. Some of them, like Israel, are seeing surges again. That's what's leading to this idea that perhaps the efficacy, the effectiveness of the vaccine is waning over time or getting less over time. And then some areas like Britain that have experienced a surge kind of paradoxically are seeing that decline a little bit. And so that's something that we'll be watching closely as we see this surge that we experience. The next slide just shows you those purple tiers, and really the only county that has even one marker out is Tulare. All right. In California, as I mentioned, new cases seem to possibly be leveling off, but at a high rate. Hospitalizations remain very high across the state. Deaths are expected to increase. And across the state, including in Fresno County, the vast majority of cases, hospitalizations, and deaths remain as unvaccinated individuals. We are seeing breakthrough cases. You see a lot of, I think there's 3, I believe, U.S. senators who have had breakthrough COVID cases. I'm not aware that any of them have been hospitalized. What we are tentatively finding is that while there are some hospitalizations and deaths in vaccinated people, it typically are amongst those at higher risk. So those populations that have underlying health conditions or an older age range, but at a far, far, far lower rate than what we're seeing with unvaccinated individuals. So again, cases remain up around the nation. I'm going to show you a map in a minute. The South is just getting slammed. It's really, really challenging for them right now. As I mentioned earlier, they just don't have enough beds or staff or staffed beds or anything. And in that area, they just have a lot of political divide around vaccination as well as masking. And so all of that is kind of coming together to create a tough situation. As you've heard, the CDC did endorse a third shot for immune-compromised populations. And so just to clarify, this is not a booster shot for that population. This is considered a third shot in the vaccine schedule for a subset of our population. So it's a recognition that some people, because of an underlying health condition, oftentimes these might be people undergoing cancer treatment or taking a medication to prevent rejection of an organ that they've had, if they've had a transplant and such. And so their body, because of an underlying health condition, is immune compromised. They don't produce antibodies the same way. They have a reduced immune response. And so what they found with them is even with 2 doses of vaccine, they're just not producing the antibodies. And so they're hoping the third dose will trigger that immune response. So this would not be considered a booster for that population. It's just saying the schedule for people who are immune compromised will be 3 doses in the future. A booster dose is likely to be recommended for all persons who receive Pfizer or Moderna 8 months after the second dose, but that won't be effective if it gets approved until about a month or so from now, which coincides with when those doses started anyways. It's about 8 months after the average person would have received, or the first people who got the Pfizer or Moderna would have gotten their second dose. But that's not official yet, so that could be coming. And that's something that we're attempting to prepare for in case it does come. And again, as I stated previously, Pfizer or CDC is expected to give final approval to Pfizer and likely Moderna. And just one more, I'll back up just a little bit. If you got the Johnson & Johnson 1 dose, it is anticipated there will be some sort of booster recommendation, yes or no, out of Johnson & Johnson. It's just right now, it's the Pfizer and Moderna that recommendation is being considered. So looking at the nation, you can see here, this is a vaccination map. The darker the color you see on your screen, it's kind of a greenish blue on my screen. The darker the color, the higher the vaccination rate. So you can see very clearly in the southeast portion of our country, the lower right-hand side, and a little bit through the middle swath, the Midwest, very, very low vaccination rates. And then the next slide is case rates. So the darker the slide, the darker the area, the reddish, it starts yellowish orange and gets to very red purple. That is where the highest cases are. And then this next slide shows you hospitalizations. And so it's pretty clear right now, I think it's kind of undeniable that in areas of our country where we have low vaccination rates, we have higher case rates and higher hospitalization rates. But that's, and here in Fresno, even though, if I'm going to go back to that green slide, even though we're not at the darkest, we're also not at the lightest, we are seeing a surge. So even in some of our darker areas of the country where we have more vaccination, we are seeing a surge because there's still unvaccinated people even in those areas. And so the final slide I wanted to show you today before I take questions, this is an interesting slide. You won't be able to see it, so I'll explain to you what it is. This is the curve for the 1918 Spanish flu. Remember, the Spanish flu started in roughly 1918 and continued well into 1919 in terms of the surges. So it's very normal with a virus in the circumstances of the Spanish flu, we did not have a vaccine. So these surges are much higher even than what we're experiencing with COVID. But this is what a virus does. It comes in a surge and gets a first group of people, and then it circulates. Some people might have a natural immunity, some people might have gotten it and don't get it again, and then it hits with a vengeance. And then you think it's over, and it comes right back. And so we should not expect any different with this. Again, no matter what your politics, no matter what your ethnicity, no matter what your religion, the virus doesn't care. It's going to go its course. And that's what we're seeing. And hopefully, much like the Spanish flu, this wave will be lower than the last one. But we're in a new world. Back when we had the Spanish flu, people weren't traveling like they are. You didn't get large populations like we have now. We didn't have as many people. We didn't have people living as closely together across the world. We didn't have people traveling across the world. And we did have, there were anti-mask protesters then too, to be honest. But viruses are viruses. They don't care about us, frankly. So with that, we will go to questions. Okay, you'll probably answer this, but will we be getting the booster shot through DBH? If yes, when can we expect it? Because it hasn't been finally approved, I can't give you a definitive answer on that, but we would anticipate that we would make available the booster shot if we're able to. Now, one thing I'll mention that Dr. Bora mentioned on his update is that back when we were giving the vaccine to begin with, which was back starting in January, I believe, there were not many places you could get the vaccine. And so, you couldn't go to CVS, you couldn't go to Walgreens, you couldn't go to the fair, you could go to the fairgrounds, but we didn't have as many resources for the vaccine. It took a while even to get Pinnacle in place. And so, it's not certain that all of the same resources will be put back in place, but we will be assessing in conjunction with public health how many vaccine doses are available, how many locations are available, and make an attempt to see if we have the right setup today, given all the additional places to get vaccinated, in order to assure that people have a place to go. Now, I will say the question on the call today, and this is something we'll be sorting through, is if that third booster becomes available, there is a little bit of question about what if people haven't gotten their first dose yet, and now all of a sudden there's a run on vaccines for the booster shot. And will there be enough vaccine for both? And so I'm not saying you should worry about that at this point, but it is something that they are looking at just in case that question comes up. I would tell you that definitively we would like to prioritize people getting their first dose. But as time passes, we'll just have to see, and we'll for sure what we will do is communicate with you so that you know how to access what might be available to you. And someone said they postponed an elective surgery due to concerns with hospital crowding and shortages of staff. Okay, and we want to reiterate the need. If you're unvaccinated right now and you're working in our department, you need to have a surgical or N95 mask on. I'm wearing an N95 mask right now. I'm vaccinated, so I also want to reiterate again, and I cannot make this point enough. People have a right to not be vaccinated. Even with the vaccine mandates, you can have a medical condition that you have a healthcare provider sign and not have to be vaccinated. You might have religious beliefs. You just have to check a box and submit that form, and you won't be subject to the vaccine mandate. You still have to wear the mask. You still have to be tested. But we will not discriminate against you. And if I hear of anyone shaming, blaming, discriminating, about whether or not someone's vaccinated or not vaccinated, that's not acceptable. I just want to make that very, very clear. We do want to follow the mandates. We want everyone to follow, what we've been mandated to do. However, We're not going to shame people. We're not going to blame people. Everyone's making the best decision they can make for themselves and their family with the information they have. As I've stated previously on this update, my goal is to provide you with accurate information to help you make the best decision for you. But I understand that everybody's make the best decision for themselves. I can't make that decision for you. Okay, off my soapbox. Any updates on kids and vaccination? There is a lot of pressure on the vaccine research trials to produce a result. What I've read, and any of us could read this, I'm not an expert on this, but what I've read is the goal, the hope is that those trials, because they are trialing it right now, would produce a vaccine for kids under 12 by the end of the calendar year. That's the hope. Okay. If it turns out we are required to get a booster shot but refuse due to adverse side effects, will we then be considered unvaccinated? It's way too soon to ask that question, but I do not believe that that would happen. That's just my belief, but we'll see. What I will say, though, with vaccine side effects, and I know not all of you watch this update every week, and so I'm just going to repeat myself a little bit. Side effects from vaccine might not be the right terminology. There could be side effects, and there could be, we definitely have seen some side effects from some of the vaccines. But vaccines are designed to trigger an immune response in you. When you get that immune response, some of the symptoms you will have will feel like you got the virus or a virus. It happens with the flu, it happens with other vaccines. The COVID vaccine is no different. It's not the virus you're getting, it's an immune response that you're getting, which is what we want you to get, because we want your body to produce those antibodies that will help you fend off COVID when you're exposed to it. So I just want to make sure you understand, when you feel a little sick or tired or feverish or that type of thing after a vaccine, it's not because the vaccine didn't work, it's because the vaccine did work. It triggered an immune response. And those symptoms are very, very similar to what you would get if you get a virus, because it's your body recognizing a foreign thing in it, which is that protein that the mRNA and the viral vector vaccines are all basing their vaccine response on, which is showing your body the protein and your body saying, whoa, wait a second, what's that? I better get that out of my body. It produces the cell activity that gets that out of your body, and that immune response is what increases your temperature and tires you out and makes you feel like crap. We want that. That's hard to say because people don't want to feel bad, but that's what we want. That tells us that it's working. Okay. Are you required to get the same brand on the booster? That is the recommendation right now, is that if you got the Pfizer, get the Pfizer. If you got the Moderna, get the Moderna. If you got the Johnson & Johnson, wait and let's hear about it, but don't go get the Pfizer or Moderna at this time. That could change in the future. And, I should also say that these booster shots are a bit controversial around the world. And the reason they are is, we're a highly developed, very wealthy country that has made vaccines widely available to people, and we still have parts of the world where they haven't even gotten one dose of vaccine. And it feels, to some parts of the world, very selfish and, what have you, that we're going to give a third shot when some parts of the world haven't even had one. The one thing I'll say about that, just my opinion, is that particularly for the mRNA vaccines, they're very, it takes a lot of sophisticated technology and types of storage in terms of how cold you have to keep it and how it has to be delivered, that has been a barrier to getting those particular vaccines to parts of the world. So I'm not sure how you can entirely fault the use of the vaccine when you couldn't maybe get it there anyways. And so hopefully they're working on solutions. The United States has made hundreds of millions of doses of vaccine available across the world, and hopefully they're working out those solutions for how that storage and delivery of the vaccine could happen in underdeveloped parts of the world, because we definitely do need those parts of the world vaccinated. We won't get out of this if we're continuing to have huge outbreaks and new variants emerging in other parts of the world. It's not enough to just get the United States vaccinated. When will the California Department of Public Health and the CDC start giving the public education about and easy access to treatments such as monoclonal antibodies? Vaccines are only one part of dealing with an endemic virus. Thank you for saying that. An endemic virus, we're not there yet. You call it endemic when you kind of stop fighting it as much and you accept that it's part of what we're doing. And we're not, when you're having surges like we're having, you don't call it endemic. When it's overwhelming your healthcare system, it hasn't gotten to the endemic stage yet. Endemic is how the seasonal influenza is considered. It's part and parcel to us. Yeah, we have a vaccine available. Not everybody takes it. People get sick, they get hospitalized, they die of the seasonal flu, but not at a level that we as a society have decided that we're going to do very much about it. We've just accepted that seasonal flu is here with us, that some people are going to get hospitalized and die. We don't mandate that vaccine. You're allowed to get the seasonal flu and die all on your own, your decision. But it's not happening at a level. Common cold is kind of like that. It's where something has become accepted in your society, and typically that happens when there's a certain level of resistance that the majority of the people have. So the incidence of the virus and the severity of the virus is not so great. That it's impacting things like hospitals and such like this is. So it will get to an endemic stage, please, let's hope so. But in the meantime, yes, there are some treatments, and I just read about one this week, and I don't remember all the details, so I'll try and remember to report out on it next week. There are some treatments that are helpful, and some of them, like monoclonal antibodies, are kind of interesting because you have to deliver them very, very early. And so one of the things they're finding with the Delta variant is some people are getting to the hospital, pretty late in the course of their illness. They're younger, they're unvaccinated, they're healthy, they don't think this is going to apply to them. And by the time they show up in the hospital, the monoclonal antibodies may not have the same ability, or some of the treatments, it may not be the monoclonal antibodies, but some of the treatments aren't as effective when you deliver them later in the game. And so I can tell you 100% every single available treatment is being used right now. There are, is it available to the degree that you might think we need? I can't confirm that, but I can tell you that, and I know a few people who've been hospitalized with COVID in the last several weeks, actually, both vaccinated and unvaccinated, and they all got treatment while they were in the hospital. And I think at least for one of my friends who was unvaccinated and very healthy, when they were admitted to the hospital, it probably saved their life because they almost died. And so that's for sure. We need to, they are 100% continuing to work on treatments, and treatments will be part of how we get to endemic stage of the virus, for sure. Can staff who are symptomatic go to the DBH testing sites, or is that only for people who are surveillance mandatory testers? You cannot, our surveillance testing is set up in such a way that we don't actually want you to come into the building if you're symptomatic. That would kind of go against what we're trying to accomplish with the screening and such. But if you contact Human Resources, we will assist you with finding a location where you can get tested if you're symptomatic. You certainly can call your physician. There are a number of places. I know if you go, for instance, to like a Walgreens, they have a drive-through testing. They give you the kit. You put it up your nose yourself. You put it back in a plastic bag or a vial, put it in the little thing, they take it. And so you never have to, nobody's touching anyone else. I know that because I've had that I've had that test at Walgreens. And then my son had a regular he had a doctor's appointment a few months ago. One of my kids had a sore throat. Oh my gosh, maybe he has COVID. Went to the doctor. They made you stay outside in a drive-through lane. They tested you before he could ever go in. It turned out he had strep throat and not COVID, because strep throat still happens even with COVID. And so he had to wait until he got a rapid PCR test that was negative, and then he was allowed to go inside, and they did the strep test, and sure enough, he had strep. So it's really better if you're symptomatic to go down that route also, so that you can see your doctor and make sure you're okay. Are our testing sites currently for employees only? Yeah, you know, because of the surveillance testing we're trying to do, we are, you know, only making them available to employees. If that changes, I will let you know. There are Pinnacle test sites that have been ongoing for county employees and their families all along. And those sites, which I believe are all outdoor sites, are still available. So you should get in your county email. I know I have. Typically, they're happening at the JJC campus and at the DSS campus, if I recall, and maybe downtown. But those are happening every week, and your family can go there. And then, yeah, not all locations do it. Someone said, make sure you call Walgreens, CVS. Not all locations do it. I went through it this past week. I will tell you that testing is one of those things. I mean, we talked about places to get the vaccine. Certainly the need for testing is increasing with this surge, and so that's one of the things I know that public health is looking at to make sure we have adequate test sites. And I'll report back out on that next week. Yes, there is a home test also. Someone mentioned that. Thank you for mentioning that. I know a couple people who've used the home test. So far, I've only heard negatives, but you could have a positive. In terms of what it costs to get testing at a pharmacy, right now with COVID, I believe, and you can go on the Department of Managed Care website on the state of California, and the Department of Managed Care website for the state of California oversees private insurance. So just to make that clear, because sometimes we use managed care terminology in our department, but this is the Department of Managed Care. Your insurance company is mandated to pay for COVID testing, so you should not have to pay for testing. And if you go on the Department of Public Health website, they'll also guide you to free test sites. But yeah, when I went to Walgreens, insurance paid for it. They aren't required. They have to give you the test. If your insurance doesn't pay for it, they get money from the federal government. So when I went to Walgreens, I had provided them, my husband and I both got tested, and we had both provided them with our insurance information, but they ended up calling us like for weeks afterward to say, what's your insurance information? Finally, I called them. I'm like, what? Anyhow. Yeah, and then one person just said they keep a couple of the home test kits. Right now, the home test kits, you have to buy yourself. I think they're probably about $20 for one or two kits. I don't remember if there's one or two in them, and you can get those over the counter, I believe, at like a CVS or a Rite Aid or a Walgreens. I'm not advising you to buy one. It's an option that you have. I do believe right now that we have enough test sites available that you shouldn't have to rely on that, but hopefully we'll get to the point where those are readily available for everyone. Okay. Oh, I have some questions on here. What do we do if we don't feel safe at work because peers and/or managers continue to downplay the virus and do not feel the rules that are put in place do not need to be followed, like not having to wear masks in the hallways, non-vaccinated people continue to wear a cloth mask, and not allowed to shut your office door if you want to take off your mask? Thank you for sharing that information with us. What I will tell you is it is our expectation that whatever rules get into place are followed, and we take that seriously. And as a leadership team, we're working right now on a process to both ensure that the management team understands what the rules are. The management team is aware of what the rules are about masks, who needs to be wearing masks, et cetera, and that type of thing. And so we will continue to work with you. Please feel free to share this information with us. We rely on this type of feedback to make sure that all of the measures we've put in place are working. And now that we are returning to office and seeing persons served, how can we help mitigate the spread with persons served that are not vaccinated? One of the things, and I might have this sent out, and this could be controversial, I suppose, but, a lot of people have very legitimate reasons for themselves as to why they're choosing not to get vaccinated. And, as I said earlier, shaming people into it or trying to make them feel bad about it is not going to help. And so what we can do is we can certainly provide masks and that type of thing to the people we serve. We can, ask them each time they come if they're interested in getting vaccinated, because we do have vaccine available at our metro site, or we could assist them with getting to a site to be vaccinated. If they have any questions, direct them to how to get information so that they can get their questions answered. Just like all of you, my goal would be for everyone to have the facts that they need to make the best decision. But the other things that we're doing is we're screening, for people coming in. We're requiring masks to be worn. We are, we've properly configured rooms and such, so we're not allowing more people than need to be in an area. Most areas still have a hybrid work schedule. We have the filters and all the different systems in our HVAC systems. We put together our return to on-site work plan so that whether we're in a surge or not, it describes what actions we've already taken and actions we will take and actions we can take to mitigate the spread. We're doing the surveillance testing, which helps to tell us whether or not our efforts are working. And I'm happy to say that we've had thus far, I'll just say it this way, less than 1% positive rate through our surveillance testing. And so thus far it appears that, what we're doing is working. If at any time it appears that it's not working, we will adjust what we're doing. And so, in the midst of a surge, right now, I think the best thing we could do is get that return to on-site work plan together, because it describes all those things and it provides guidance on what we should be doing. And it is a living, breathing document, and we will adjust as time passes. Obviously, we're constantly looking at those case rates and constantly looking at what's happening with our surveillance and constantly in communication with public health to make sure that what we're doing is effective. Okay. If you need to be tested per recent orders, note that the home test kits are not acceptable. That was from Helen Herrera. We aren't allowed to allow you to use the home test as evidence that you had a negative test, so just so you know. Okay, and allowing staff to close their doors so that there can be a mask break should be supported. We are told that we cannot close our door. I'll work on that. I'm not sure what that's about, but rest assured that we will speak to the supervisors, try and understand what their rationale is, and try and figure out a way that we can work through that so that staff can be allowed a mask break, for sure. All right, let me see if there's any more questions via text. I don't see any. Brian, do you see any?
No.
All right. No more questions on chat. This is a time where I expect us to get more questions, so please, during the week, if you have questions and you're having a hard time getting an answer, send them to myself, copy Tina Young, or send them to Tina and she'll get them to me. And we are happy to answer those questions through the week. For certain questions, we wait until the update because we think it might be something that would be broadly appropriate to share, but more than happy to answer your questions at any time. That declination form is available. Please go to HR if you need that. And please stay safe. Take care of yourself and your family. And we will see you next week.